Guys. So for our last lecture of the week, we're going to talk about exercise prescription for cancer survivors. A cancer survivor is any person who has had cancer, whether they're pre-diagnosis, whether they're in treatment, or whether they are kind of long-term in remission. And because even those folks, even 5 to 10 years after a cancer diagnosis and treatment, can still have some lasting effects. So no matter where they're at in that length of time, we're always going to want to keep that in mind as we're prescribing exercise. So before we get started with exercise, of course, we're going to evaluate them. We're going to think about non-cancer considerations, of course, the different diseases they may have and special conditions that we're going to think about. Age, do they have diseases like diabetes or hypertension that could predispose them to heart disease? What's their fitness level like? Were they fit before they got cancer, or have they, excuse me, never. It seems like no matter what time I record these guys, y'all, I am always yawning. I apologize. What's their fitness level? Are they already fit and then they got cancer, or have they maybe not exercised for a while? Of course, it's going to go into determining how we have them exercise. Do they have orthopedic problems like joint pain or arthritis, etc.? And then our cancer-specific considerations, we're going to think about the type and stage of the cancer they have, the type of treatment and the side effects of the therapy they've undergone, the psychological effects as well of the therapy that they've undergone, and them having cancer, which is a major life-changing event for many people. And then what's the timing of their testing that they're doing and their therapy? Because if they're in a kind of an intense round of chemotherapy, or they just had radiation, or just recently had surgery, that we're going to take all that into consideration as we're prescribing exercise and make sure not to put too much of a workload on them at that time. So we talked in the last lecture a little bit about types of cancer treatment. So I wanted to actually put some more information into this last presentation because I think understanding the side effects of cancer treatment are important if we're going to prescribe exercise to folks who have cancer. So we have surgery, radiation, chemotherapy. And chemotherapy, there's some different types of chemotherapy. We're not going to really go into those too much. Cytotoxic is the kind where we're killing cells and keeping them from reproducing, and that's one that's pretty tough for people to deal with. Immune therapies kind of ramp up your own immune system and help it to fight off the disease, and then we can also use some hormone type of therapies as well. We'll talk about each of those a little bit here. So the goal of chemotherapy can be to quote unquote cure the cancer or kind of completely eradicate cancer from the body. It can also be to control the disease by stopping cancer growth and metastasis, and that's going to help extend life and provide quality of life improvements. And also by using chemotherapy to shrink the size of the tumors, they can be more easy for surgeons to remove. Chemotherapy might also be for the sake of palliation, which is increasing comfort and increasing quality of life towards the end of life. It can be oral medication or a venous infusion, just depending, and sometimes it'll be a combination of both. So chemotherapy, which is anti-neoplastic or cytotoxic in nature, these are going to work at specific phases of the cell cycle, such as DNA synthesis. And these are very effective drugs because they work, right? For example, one type of chemotherapy that my old pet Jaeger dog, my old dog Jaeger was on, actually helped me. I learned a lot about cancer when he was taking medications. He was on one of the kind of popular types of cancer drugs called oh gosh, what was it called? No, anyways, it was a cytotoxic agent, and what it did was it worked on the it was an alkylating type of drug, and it worked on the small strands that when cells are dividing, and we have the cell goes through mitosis, and the chromosomes split down the middle and then are pulled back to the nuclei of two individual cells by these long strands. That type of chemotherapy kind of broke down the strand so that cells couldn't replicate. So these are really effective drugs. They work very well, but they affect both healthy and cancer cells. So they kill the cancer cells, which is important, but they also affect other parts of the body that can lead to some really severe side effects. And we'll talk about those in the next slide here. Okay. So these can cause toxicities. Let me get my little pointer here. Okay. So they can cause things like cardiotoxicity and pulmonary toxicity, where we have some severe functional problems with the heart and the lungs. Some common side effects that occur, these side effects are going to occur in cells that have a rapid level of reproduction. So any cells in the body where the cells are kind of rapidly turning over, rapidly growing, are going to be affected. This is where hair loss comes into play. The hair growth is affected by chemotherapy because the hair cells are rapidly growing our hair. It can lead to infertility in the reproductive system. It decreases bone marrow activity, and bone marrow, remember, creates blood cells. So we have decreased blood cell activity from the bone marrow. Neutropenia is a decrease in white blood cells, so we have some immune issues. Thrombocytopenia is decreasing platelets, so we have more bleeding than normal. Can lead to nausea and vomiting and mucositis because the cells that line the digestive tract are epithelial cells, and those cells are quick turning cells, so they're going to be affected by chemo too. Some biologically directed agents are endocrine therapies, antibodies, and tumor vaccines. These target malignant cells or the biochemical processes that control their growth. And then immune therapies stimulate the patient's immune system to fight cancer. Those can have some side effects that are much like the flu, fever, malaise, chills, headache, and fatigue, because when the immune system is working, that's how you feel. So that's going to be, it can be a real problem. It can also lead to capillary leak syndrome, where we're going to have hypertension and pulmonary and peripheral edema. Very problematic. So when we have a person exercising, we want to understand the types of medications and treatment they've been on, and how can we prescribe exercise around that. So for their physical exam, we're going to identify any acute signs and symptoms that are cancer specific and would prevent exercise prescription. I'm going to fix that whole. So fix up now. Physical exam, we're going to use that to identify any acute signs or symptoms. Are they nauseous? Are they having some issues with their heart and their lungs? These things are cancer specific and would prevent exercise prescriptions, such as, let's say a person, a woman has had can also get breast surgery, actually, breast cancer, actually. So let's see, we have a patient who's had breast cancer. They've had a recent biopsy and surgery. So we're going to avoid upper body exercise until we know that surgery is healed. If a person has bone tenderness and starts getting pains they didn't used to have in their bones, that can indicate metastasis to the pelvis, back, or legs, as an example. We can also look for gait instability from chemotherapy or central nervous system involvement. Chemotherapy can lead to ataxia, which is just gait instability and a loss of muscle contraction, a loss of muscle tone, and kind of shaky movements. We can see delayed wound healing. We have a loss of platelets, for example, immune suppression, and bleeding from bone marrow suppression or surgery. All these are complications that can occur when a person is going through cancer treatment. So there's some complications that may require modification of the exercise plan. We're also going to talk about contraindications in a minute too. So nausea. If a person is very nauseous, we don't want them to exercise. If they have mild nausea, we would like them to do some low to moderate intensity exercise. For a person, especially on chemotherapy or radiation, they may have some low level nausea all the time, and we do want them to exercise when they can. But if the nausea is severe and they can't keep down food, of course, we don't want them exercising. Fatigue, and again, fatigue is likely going to be their baseline, and they're going to be somewhat fatigued all the time. And exercise can actually help combat that fatigue. But if the fatigue is very severe, that is not going to help them, and we need them to be able to rest. Vomiting, weakness, all of these are going to be some complications. If a person is vomiting, we're not going to have them exercise. If they're demonstrating weakness, we can have them exercise, but again at a lower and safe level, and only if their doctor's clearance also applies to that case. So what are our contraindications to exercise for patients with cancer? Well, when we're going to have frequent blood work done. So if we see they have low levels of hemoglobin, white blood cells, or platelets, we do not want them to exercise. Number one, it's going to impede their ability to exercise. And number two, if they have low blood counts, they really need all their energy to help with that, increase that blood cell count, and not to exercise. If they have a fever greater than 100.4 degrees Fahrenheit, severe nausea, if they have unsteady gait or ataxia, if they have severe weight loss, that's also known as cachexia, we don't want them to exercise. If they are out of breath to the point that when they're trying to exercise, they can't exercise because they're so out of breath, then we don't want them exercising. They have pain, they have, I'm so sorry, guys. If they have pain in their bones that might indicate metastases, we want to have that checked, of course. So all of these are, when these issues arise, you're going to want to contact their doctor or have them contact their doctor, and you should be in contact with their physician as well if you're helping them exercise. And we want to find out, can they exercise or not, and what do we need to do to make sure that they stay safe. So an exercise prescription is obviously important for these folks, and it's also important to note that they do not require ECG monitoring when they're exercising. We do want some supervision, obviously, though, and some instruction, but having cancer can go on for a long time for people, and we want them to be able to exercise with us, but also without us too. And not all patients are going to be able to afford full-time personal trainers either. It's also something to consider. So we want to be able to set folks up for success in the long term. We want to instruct our patients on the types of exercise that are best suited to their type of cancer. They can exercise with us in a healthcare facility, at home, or outdoors, depending on what's available to them and what's going to be safe. And for exercise, let me get let's go highlighter. All right, so for aerobic exercise, walking or stationary, oh, that's my pen. Hold on, I didn't want the pen. All right, so we want walking or a stationary bike is great. They could do low impact aerobics. We want to watch out for things that are going to make them unstable. We want them performing exercises that use large muscle groups. We want to combat that loss of muscle mass. Moderate intensity. We want them to be able to talk during exercise. 3 to 5 times per week is great, but we want to be flexible to accommodate any scheduled cancer treatments. The duration is 30 to 40 minutes. Progression by 30 seconds to 2 minutes per day. And you might not be able to start with 30 to 40 minutes. You might need to do a couple of sessions to meet that. Hey, Dot. Hey, buddy. Shh. Okay, so there are a few things to consider. Patients that are unstable may benefit from using a recumbent or stationary bike, or chair aerobics would be great too. We want a nice, easy intensity, and you want to keep them in that RPE around 11 to 13. They might have an elevated heart rate due to lower blood volume or due to discomfort, etc. as well. That's important to remember. And we can divide their exercise sessions into 2 or 3 sessions per day, beginning at 5 to 10 minutes if necessary. Okay. And then for resistance training, both machines and circuit training are going to be for resistance training, both machines and circuit training are going to be really helpful. Doing stretching and yoga are both going to be great for cancer as well. I wouldn't do a 1 rep max, but you can do a predicted 1 rep max. So how much can they do in maximally 12 to 15 times and then go from there. We want to increase muscle strength and endurance. Machines are a good idea as opposed to free weights if you have a person who's got some muscle mass loss or some instability for sure. And then stretching before and after exercise to increase flexibility and range of motion. Yoga and Pilates and Tai Chi are also going to be great types of alternative exercise for them that'll help to increase that as well. Okay. Some possible setbacks that can occur. We may have some side effects of chemo and radiation. They're good. Sorry. We have some side effects of chemo and radiation that can hold us back when we're exercising. They may have to have additional surgeries. We have to plan around that. Their cancer may not go away, and it may not make it worse. They may end up with metastases and pain, and we may need to work around those too. And you just want to make sure to modify that exercise. We want them exercising if at all possible. It's going to help them through so much and help them feel better and be healthier too. But we might need to suspend their exercise if the risks of exercise outweigh the benefits. So if we're in those contraindications and we really can't exercise safely, that's, we want to focus on their health, number one. And there's some factors that might lead to modification. If they have extreme fatigue or shortness of breath, nausea and vomiting. If there's bone involvement, the exercise of affected extremity may cause them pain and injury. If they have metastasis in the bones, we want to avoid high impact exercise because we don't want them breaking bones because they really are not going to heal well. And a stationary bike is great for exercise. We want to avoid upper body work for folks with breast cancer. All right, guys, so this is the end of our cancer module or set of cancer lectures. Jump on over. You're going to have an assignment and then a case study for cancer to finish the week. All righty, guys. Thanks. Stay safe, and we'll talk to you soon.